and they're gonna the team will play with this, so like we just talk and then the mess. But so anyway, we were talking about places. So where you said like not maybe California school systems. Like
Well, it just depends on safety, right? And economics, right? So for a lot of people, California is very expensive. But if expense is no problem for you, I would look at like Santa Barbara, Palm Springs.
well, Santa Barbara was definitely
Yeah.
so okay. So I will. I really said I wouldn't do California again.
So here's what you do. You get two places, a vacation spot in the mountains, and she can have her city spot.
All right. So which city though?
It depends. What does she like?
Western love San Francisco. That's a pause right there. That's a big pause. Would you ever live in San Francisco?
No,
Haven't.
I don't like San Francisco. I like going to like the entertainment in San Francisco, but actually living in San Francisco, no, too many homeless people.
Yeah. When
Oh, it's
no.
everywhere now.
Yeah. But do you think it even like San Jose is a major metropolitan area, like it has its own vibe.
Yeah, San Jose got millions of people. There are 3 million people living in San Jose, and there are lots of companies there. So you live there and you can get, especially high tech, a lot of business
Yeah.
in San Jose.
Well, so yeah, that's I want to be somewhere where I mean, like I said, with the internet access, I mean, I could be Louisiana. I really like it. I don't know Monroe.
Monroe is small. It's a small town. They got about 120,000 people living there. It's not a city life. It's I call it country. I have my friends, I have my family. Most of my family lives in that area. My university is there, right? So, well, yeah, Monroe is surrounded by 3 universities. You got Grambling State, you got Louisiana Tech, and you got Monroe, Louisiana University. So that's 3. Um, hi- it's highly educated.
Yeah, it's good to have that in university and textbooks. Like, I mean, you're getting a good mixture of people.
Right, but you want somewhere where, you gotta always have baby girl in mind, right? So you got to always think about safety for her. Where are the best, places for education? You can Bateau needs to be around people, so you can I if you can afford it, I would have my little mountain vacation home and my little livable spot. Right? Because and you got to think about too, how long are you going to do this for? Right? Is this going to be your forever home? Are these going to be places that when you put down roots, you're going to be there until you're in your 60s or 70s, right? Where are you going to eventually land?
Yeah. So, well, that's the thing. So I told you we opened up an office in the Philippines, and we got kind of 20 people there now, and they're fantastic people, and the cost of living is dramatically lower. And it's where we're at is it kind of a beach. It's more of like there's Manila, which
Right.
the Philippines, 10,000 islands. So Cebu is the second largest island, but it's a very beach kind of community. And so we're thinking, and of course we obviously met Dubai. So we were thinking, well, we want to be sometime overseas, and then in the summertime to be somewhere in the United States. Now you said now I got to think about school districts. Solution is
Well, there is no school in the summertime. School is up.
yeah, I was thinking like 6 months, but it's 6 months, like April to whatever. But here's the solution: I could send her to military school, and then she goes to the Netherlands, and then it's all done.
Stuff goes work out. How about Hawaii?
Oh, there you go. That's now you talk about expensive.
Yeah, it is expensive. Just don't go to Oahu.
Which island do you like the best?
I do like the Big Island, but only as a tourist.
Andrea Trudelle. We've been talking about where to live and so forth, but for the audience here for this podcast, the Access Care Pod, uh, I am At least.
Yes, 25 years we have had a business relationship, and it has been great.
Oh, it's amazing. It brings almost a tear to my eye to hear this. But I have to say, like, I'm trying to think. The first place that we met was it KLA Temple? Does that sound right?
It was Advanced Micro Devices and Lou.
In lieu. Wow. That's funny. So 25 plus years. I have to say, like I've always said you're like I said there's like 3 or 4 godmothers of benefits that have guided me. And so Cindy Conway, you, there's Nita McQueen.
All of them I know.
Yeah, yeah.
We all I say we all grew up together in benefits, um, and we've been at it for a while.
And I mean, that's what it's so interesting. Like I'm thinking about this as of the last 25 years, and as the progression of careers and it's just, I mean, you must have seen everything under the sun, especially different companies that you've worked with. I mean, you're in.
I came from high tech, and so the difference is communicating, right? In high tech, everyone has a desk. In retail, everyone does not. So you have to be creative in understanding how do you reach the people in the stores that don't have desks? How do you reach the people that are in the supply chain slash distribution centers? They don't need laptops and computers to do their jobs.
Yeah. So even between those 2, what you just mentioned as the retail people and the distribution centers, there's gonna be different demographics, different ways of working. It just so would you s I would almost think that's significantly different than, say, the high tech area where you might have more, can I say this, more of like the same because they're all at a desk? Or do you feel like
Well, in the high tech areas, the companies that I worked for, you have a lot of engineers that you are communicating with. Yes, they all have desks, right? And so they're easier to reach. And then you have retail, they're spread out
yeah,
and there are um, minimal folks in a location. So usually in retail, you probably don't have 15 people in a store, right? So it's those people, it's hard to bring services there.
yeah. Well, I looked at it like that. Now this is my, only my perspective, right? So, of course, I've enjoyed and learned from all of my experience, whatever the demographics of the employees that we get to or that we're honored to support in your initiatives. But I will say, since doing this with retail, grocery stores, call centers, um, production workforces like we've done work in Louisiana, people, oil rigs and doing the pipes. I mean, that's what SLB does. But those people, they really need this. So for me, it's like for me at this stage of my career, I feel like it's really rewarding to be able to bring that healthcare to that demographic.
Yes, and a lot of blue collar workers, um, unfortunately, they are in healthcare deserts, right? And it's going to, I think it's going to grow. And so I think making healthcare accessible is going to be very important. And I think that's the value that access care brings, right? Because you go where the need is. And it's us, the benefits managers, who have to determine, okay, how are we going to make this work and how are we going to make this effective?
Yeah, well, I mean, I look at it like I follow it as I have for the last 25 years. I mean, that's like I said, that's why you're the godmothers of benefits. I mean, it's like because you're teaching us, you're pushing the boundaries, and you know, I- I'm for me, what keeps me interested in things is the challenge of it. I have to think that's probably the same.
Yes, we do.
There, I mean, I'm not going to make it in my entire lifetime of this little town in XYZ state, but it's like for me, it's like that's what's really interesting. Is just try and keep it accessible. Try and make it so that it's going to change the or increase the agency of an individual to take care of themselves. And so we want to give them that information.
Absolutely, because a lot of folks in retail, they don't have the access to care because they can't take the time off sometimes, right? And so bringing the care to them makes it that much more impactful.
Yeah.
I know that when access care comes onto our campuses, our employees are excited, right? And they feel cared for. And for us, that's important, right? Because for us, our employees are the fabric of our success, right? We say it all the time. And for me, it's prove it, right? And so bringing care to them is proving it. We want you to get your dental work done.
Yeah.
We want you to, take care of yourself. We want to help you with that journey.
Like that teaching us and for the employees that we have been associates.
We call them employees.
Well, I have to think it's got to be one of the first in this type to go to the smaller locations because I mean retail benefits group that you got us to go to that 2023 that was fantastic and you're still leading the pack of it.
Yes, our employees had never seen anything like this, right? Usually something like an access care, it's very familiar in high tech.
Yeah.
In retail, it's not familiar at all. So when we brought this to them, not only were they wowed, but they were like, wow, and they were happy.
Yeah. Yeah. Well, if we could like if we could move the needle to get them more interested in their own health and then get them improve, I suppose, the cadence of going to see healthcare providers and just I don't like I always think about this is like people always look at the mouth as the seventh part of the body, like it wasn't connected to the rest of the body. But I think about now at 51, I think about retirement, and I want to like when I'm in retirement, these should be the best years of my life. That means I should want to be as healthy as I possibly can, and particularly for eating. Like I want to have all my teeth, so I can be eating soup every day. So
Well, I am of the thought process that dental health impacts your overall health. And that's why it's important for us to bring dental health to our employees. You can get your teeth cleaned, you can get your dental exams right on campus. I mean, that's like one of the best things that they've seen, right? And so bringing that to our employees and doing it, removing the cost barrier is exciting.
that's good.
Mhm.
Well, I mean, we're back here in Dublin, California, not too far from when we first met 25 years ago. And I mean, I know that I'm still learning every time we talk. I mean, and I just wanted to say thank you so much for being a valued partner and friend and teacher and mentor for the years. And so thank
Thank
you.
you. Thank you for staying connected. Thank you for continuing to innovate. Um, you never cease to amaze me with all of the innovation that you come up with, right? And I'm here for the ride.
Well, that's great. And as we are in Bella's crib, it's a very good metaphor. This is 14,000 miles and counting, and I hope to be back in the Bay Area to see you. Or next time, I don't know if you're traveling and to any of these open enrollment sessions around the country, but let me know. And I'll come.
No, I'm not. I have a benefits manager now, and so I'm letting the team do their thing, and I'm gonna step back into my seat. So I won't be traveling this year.
Always happy to come back to the Bay Area. So
Yes.
I'm going to thank you so much for this time.
Thank you, Joshua. It has been my pleasure.